The field of cosmetic surgery is no longer dominated by female patients. In recent years, a growing number of men are going under the knife to turn back the clock. Could it be they just aren't as willing to admit it? Dr. Mark Solomon is here to discuss the latest trends in male plastic surgery. Dr. Solomon, you have over 15 years of experience as a plastic surgeon and are co-editor of the only textbook on male cosmetic surgery currently in print.
That's correct.
Have you seen an increase in the amount of men that come to you for procedures?
Well, I think for me overall, the amount has been consistent because of my interest in performing procedures on men, but across the country, men are having more things done, not necessarily surgery, but also non-surgical procedures.
While the amount of procedures has dropped slightly, a survey conducted by the American Society of Plastic Surgeons, or Surgery, found that 52% of men approve of plastic surgery.
What it tells us is that as a culture, we're accepting of trying to look the way we feel. That plastic surgery helps us achieve a goal that's in our brain that the mirror doesn't reflect.
But that positive shift is about getting the procedures, not necessarily talking about them.
Most of my male patients are of a sort of a high-powered CEO type, professional type of individual who really don't want to admit to the world that they've been getting these kinds of procedures in order to maintain their competitive edge. So they're not going to go public about it.
What are the most common surgeries that men have come to you for?
I see patients for, male patients for facelifting, and not just facelifting alone, but facelift, brow lift, eyelid surgery. So that's one group. Now there's another group of men who want to get their noses done, or pectoral implants, or liposuction. And a third group is patients who get penis enhancement.
I read that new innovations in facelifts can have the patient back at work in a few days with minimal swelling.
I have patients who, for example, get surgery and then go into their office at 5 p.m. for a couple of weeks and get their paperwork done till 9 or 10 o'clock at night so that their staff doesn't see what they've done.
I see. Women aren't the only ones that can get a breast reduction.
That's correct.
Yeah. Can you explain what that is and how it's done in men?
Sure. Breast tissue in men comes about through any number of reasons, mostly for reasons that we don't understand very well. The nicest way to get rid of it is with liposuction, because although liposuction removes fat, we use cannulas, tubes that are modified for breast tissue, and they're slightly bigger, and they can suck out the breast tissue through little incisions in the armpit and in the chest. If a man has an even bigger problem, we may have to do a procedure that's more akin to what we do for women, which is take some skin as well, but that's going to leave some scars.
What about hair transplant? I would think that that would be one of the most popular procedures.
It is. Most people who do hair transplants are not plastic surgeons. Actually, dermatologists do most of that work. I don't do much of it at all because it's not an interest of mine, but it's certainly a great technique, and it has evolved enormously in the past 15 or 20 years.
Well, I imagine that someone would need to be in good overall health to undergo plastic surgery.
That's correct. Health is an issue more than age.
Well, I thank you very much, Dr. Solomon, for all the information you've supplied us.
Thank you for asking me.
Thank you for watching, particularly men. I'm Suzanne Roberts. We'd love to hear from you. I may even end up reading your comments and questions on the air. So write us at the address you see on your screen.